In previous session, we learned to classify the joints by function and by structure. By structure, there's a fibrous, cartilage, and a synovial joints. And I show you this picture already. See here. Okay, the synovial joints can be further divided. In this video, we will further discuss this 6 different type of synovial joints, and with a specific joint, you should be able to tell which type of joint it belongs to after today's talk. The synovial joints can be further divided into 6 different types based on the shape of an articular surface. They are plane, hinge, pivot, condylar, saddle, and ball and socket. The plane joint allows gliding movement. So this gliding movement is across a surface. It's like the 2 different bones slide through each other on the surface. Since the movement is on a surface rather than along a line, we call this type of a movement non-axial. You can find the plane joints between carpals, tarsals, and vertebrae. Well, the plane joints between vertebrae is not the IVD. Okay, so those gliding movement or the plane joint between the vertebrae are between the superior articular process and the inferior articular process between 2 different vertebrae, which is on the posterior part of our vertebral column. Hinge joint is like the hinge of the gate. The hinge on your door allows you to open and close your door along the axis here. And the hinge joint in your body allows the uniaxial movement to flex or extend the joint, like in the elbow and between phalanges. Pivot joints allow rotation, as between ulna and radius, and also between the C1 and C2 here, atlas and axis. So when you shake your head and say no, you're using this atlantoaxial joint here, and your C1 just rotate along the dance of the C2. And that is called that kind of a joint is called a pivot joint, and this movement is a uniaxial movement. The condylar joint has oval articular surface, so it just looks like this. It allows those biaxial movement because it allows the movement from go forward and backward, and also from medial to lateral and left and right. They are between metacarpals and your fingers, and also in your wrist. So you are using the same wrist joint when you wave your hand or pat a basketball. So these 2 different movements just give you from left and to right, or from front and back. And that is 2 directions, so we call it biaxial. The saddle joint is very similar to the condylar joint. Both of them allows biaxial movement. This to allow your joint to move left to right, and both front and back. But the difference is the saddle joint look more like a saddle, just like this. Okay, so you can find it between our first metacarpal and trapezium. The last type of synovial joint is a ball and socket. It looks like a joystick or the ball and socket pen on an office desk, just look like this. And it allows the sticks a fully movement in that space, called a multi-axial movement. In our body, it always have a cavity contain a spherical head, just like in this picture here. As in the shoulder and in the hip joints. This kind of joints give the most freely movement. Think about the hip and the shoulder joints. which are the most freely movable joints in our body. And compare the shoulder and hip. Think about the bone structures. The glenoid cavity in shoulder is much shallow compared to the acetabulum in the hip. So make the shoulder, it can move more freely than the hip, so the range of the shoulder of the humerus will move like this. But however, for the hip, only can go this range. That is shoulder, that is hip. Just because the cavity shape. So that also make the shoulder become the most freely movable joints in our body, but at the same time make the shoulder most unstable joint in the body. Have you ever had a shoulder dislocation? Due to the articular surface shape of these 6 types of synovial joints, they can give us 3 different kinds of movement. In fact, we already learned those in our lab, so I will go over those very fast. They are very, very important, so you want to review your lab session and also the textbook here. Okay, refer to your textbook, figure 8.5 for the terms. So we can first divide those movements in 3 different groups: the gliding, angular movement, and also the rotation. Please refer to the figure 8.5 for all the terms. The gliding movement are like waving your hand. Flexion is to reduce the angle between bones. Extension is to increase the angle. So like bending your elbow, that is flexion, and extend your elbow or make it straight, and that is extension. Sometimes even you extend your body to further extend than the normal position, as if you extend more and like raise your head. That is called a hyperextension. Or like laying the back, and that is hyperextension as well. So bending down is flexion, and go straight, that's extension. Flexion and extension are normally mentioned movement to anterior and posterior location. If the limbs move away from the body or move towards to the body on the frontal plane, we call them abduction, which means to take away. That's abduction. And if it's take it back, that is adduction. And sometimes the body may move in a circle, and we call that as a circumduction. Rotation is a movement to stay in the same axis, so we call the rotation is a uniaxial movement, and that is only come from one joint, which is a pivot. Pivot joint give the rotation. Compared to the circumduct, which normally come from a ball and socket joint, like when you circumduct your arm and your leg. Hand movement with a palm forward is a supination, and move the hand backward is a pronation. The forward and backward, we are talking about the anatomic position, and normally if you move your palm up, just turn your palm up, that's a supination, and turn your palm down, that is a pronation. We use a flexion for foot movement. The one move your foot to the dorsum is a dorsiflexion, and the one to the plantar is a plantar flexion. Foot move medially, that is an inversion, and move laterally is an eversion. Protraction and retraction is used to describe movement that move body part away from your body or back to your body. So that's how you say retract, get something back. So that's a retraction, get your body part back to yourself. And the elevation depression is for move things up or down. The last movement is an opposition, which always involves our thumb to move towards any other fingers. I think since these fingers move in opposite direction, and that's why it's called a opposition. Please organize today's lecture in a chart as we mentioned earlier, with type of joints and examples. Joints are usually named by the bone forming it. You can find the joints name and types in table 8.2, which is very important table. Please read the table at least once and apply today's knowledge on those joints to identify all these 5 items here. For each joint in the table 8.5. Okay, and I also use a professional term we learned today. What are the joints name? What is articulating bones? And also the structure classification and functional classification. And also what are their movement for this joint allows. Okay, the movement use a professional term for it. Which of the following describes increasing the angle of a joint? The answer is B, extension. Extension is to increase the angle of a joint. So if you straight your elbow or make your knee to go straight, and those are extension. And the answer for flexion is to decrease the angle of the joint, and the rotation is a circular movement along a axis, and the abduction, that's take the limb away from the body. Abduction, AB for away. So which joints are found both in your knees and elbows? The answer is C, hinge, that can be found both in your knee and elbow.